Hold on. This is Dr. Scott Geller. We're in Fort Myers, Florida right now. We are the go-to laser floater guys. I have a great patient from Sarasota. So let me make the story, long story short. You had a crystal lens implant about a year and a half ago, was it?
It's just about a year and a half.
Okay.
And then I had the follow-up procedure that's done, I think,
Yeah,
with a
capsulotomy
laser.
you had, we call that a capsulotomy.
And it seemed like that it was after that this floater appeared, and it was like none I'd ever experienced before. I've had a lot of floaters in my life.
Yeah.
And still do, and I just sort of live with them. They're little strings of things, and but this was a blob that was actually kind of interfering with my
Indeed,
vision.
indeed it was.
And so I mentioned it to my doctor in Sarasota, and she said, well, there's somebody here in Florida who actually treats those things, and I'd never heard of such a thing.
Did the shoemaker's office mention anything about that, or
Well,
did you tell them? Or
I had not been back to them
since the capsulotomy, okay.
And I've just, it was one of these things where I was not aware that there was any possibility.
Well, you're not alone in that. Most ophthalmologists are not aware either. Maybe they'll get woke some decade. But in any case, let me just explain what you had. You had, after your cataract surgery, you had what we call a posterior vitreous separation or posterior vitreous detachment. Within the gel, this bag of gel, you had a very large, what I call fibrillar mass. It looks like a ball of cotton candy. And in your case, it was more or less gravitating towards the center, correct?
Right.
And I try to explain this to a lot of doctors that, there's a lot of sort of experience and judgment that goes into, well, how are you going to deal with this? More is not always better. So I did one laser session, and my goal at that laser session was to disperse the mass a little bit and dislodge it more or less from its dead center location. And it was, 3 weeks ago I did that?
So 3 or 4.
Yeah, 3 or 4 weeks ago. And your impression was that it is out of the central location. And there's always going to be a floater. The vitreous gel is never 100% clear. Some patients, want it to be like when we were 25. I don't think I can turn the clock back. I wish I could do that on me. But you feel that was a significant improvement for you.
Yes.
And so my advice at this point is that we have an old saying, better is the enemy of good in medicine. So we have a good result, a significant improvement from the patient's perspective. If an ophthalmologist were to look in there, he'd look and say, well, you still got floaters, looks the same to me, but you're the one who actually has to look through it. And that's what counts in this game.
Well, the main blob has been at least smeared around or obliterated, or it's not there anymore.
Yeah.
So
you're a happy patient. That's all that counts. A happy patient.
I'm a lot improved.
And someday the ophthalmologists will maybe get into it a little bit more. But I think it is a little niche type of subspecialized thing that a few guys will get into it. Most guys might dabble, but if they really don't get into it in a heavy degree, and I've done over the years, I've been doing this for several decades, probably at least 20,000 laser sessions. But I like doing it. It's amusing for me. It's a lot of fun. And I consider myself very fortunate to do this in ophthalmology. Mm-hmm. Anyway, you're a great patient, and have a great summer. It's, by the way, June of 2019.
Yes.
Great.